I'm David Allison. I'm a Director of Graduate Studies in Architecture and Health at Clemson University, professor there, and so I get a chance to kind of observe the industry as a whole. Well, I think in some parts of the international markets are faring better than us. I mean, the firms I've talked to have more overseas work as a portion of their overall workload than they've had relative to their U.S. work. So I think, but it's in certain areas. Other countries, of course, are having struggles. Some countries are moving more towards systems like the U.S., which have more constrained resources for capital construction. But I know in the Middle East there's still a lot of healthcare work going on, for one, and in some other countries as well.
I'm Scott Aaron with Coast to Coast, president of Coast to Coast. We've seen quite a bit of interest in doing things internationally, and I think some of the international areas are not quite so affected by what's going on in the United States. So it's a real area of opportunity for us.
Hi, I'm Ken Shell. I'm a project director with Scanscom based out of our Philadelphia office. I think the international markets are probably doing similar to the American markets, actually. The renovation work, obviously, they need to renovate their hospitals, maintain their equipment, and also sustainability, obviously, in Europe is pretty big. So we're seeing that as being equal to America's.
I'm George Tingwald. I'm Director of Planning at Stanford University Medical Center. I'm a physician and an architect. The international markets are very dependent on what country you're talking about. Countries that have had a severe economic problem, as the United States has, such as the United Kingdom, have had significant slowdowns in healthcare development, while countries that have had minimal impact, such as India, China as well, but India even more so, are seeing huge gains because they have capital and are trying to figure out ways to spend it rather than to invest it in the United States at this point.